Hello, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. In this video, I'm going to talk about a common heart problem, atrial fibrillation. Atrial fibrillation is present in 4% of Americans over the age of 60 and 10% of those past the age of 70. To better understand atrial fibrillation, let's first learn how the normal heart works. This is a normal heart which has two top chambers called the left and right atria and two bottom chambers called the left and right ventricles. The top two chambers are priming pumps for the bottom two chambers. The left ventricle pumps oxygen-rich blood to the body, which uses this oxygen to perform work. The low oxygen blood returns to the right side of the heart, where it is pumped through the lungs and oxygen is picked up. This oxygen-rich blood returns to the left side of the heart and is pumped out to the body where the oxygen is used. The top two chambers of the heart are electrically insulated from the bottom two chambers throughout the entire course of the heart, except for this small area called the AV node. Normal electrical activity in the heart starts in the pacemaker of the heart called the sinoatrial node, or SA node for short. The SA node is located in the upper portion of the right atrium of the heart. Once the SA node starts an electrical impulse, it rapidly spreads throughout the top two chambers of the heart, causing them to contract and force blood into the bottom two chambers of the heart. The electrical activity from the top chambers of the heart comes together at the AV node, where it is slowed down considerably to allow the top two chambers adequate time to pump the blood into the bottom two chambers. Once the electrical impulse passes through the AV node, it accelerates rapidly down two very special electrical tracts called the left and right bundles. This electrical activity stimulates the bottom two chambers to contract, forcing blood out of the heart into the lungs and to the body. Once the bottom two chambers have squeezed the blood out, the heart relaxes and fills with blood that has returned from the lungs and the body. When the heart is filled with blood, the entire process is repeated when the SA node or pacemaker starts another electrical impulse. When atrial fibrillation is present, the normal coordinated contraction of the top two chambers is lost. The muscles of the atria wiggle much like worms on the ground. As a result of this, the proper emptying of blood from the top two chambers into the bottom two chambers does not occur, and the efficiency of the heart is markedly reduced. In addition, when atrial fibrillation develops, the heart rate increases very much and becomes very irregular. There are two main problems caused by atrial fibrillation. The first problem is loss of heart efficiency. When the heart loses the function of its priming pumps, it is much more difficult to effectively pump blood to the body. In addition, the pressures required to fill the heart with blood from the lungs are higher. This increase in pressure can increase the water content of the lungs. The increased water content of the lungs makes the lungs stiff and harder for a person to breathe. These problems increase the risk of developing congestive heart failure. When a person with congestive heart failure develops atrial fibrillation, the death rate is doubled. The second problem with atrial fibrillation is the increased risk of stroke. When the atria lose their normal pumping action, blood can stagnate and clot. The clots that form within the atria can break loose and be pumped out of the heart to the body. When these clots go in the arteries feeding the brain, strokes occur. The risk of stroke in patients with untreated atrial fibrillation is 5 to 10% per year. There are two goals of therapy for atrial fibrillation. The first goal is to prevent the complications of atrial fibrillation, which include the rapid heart rate and stroke. The second goal is to attempt to return a patient to normal sinus rhythm. Digoxin, verapamil, and the beta blockers are common medications which can be used by themselves or in combination to control the rapid heart rate frequently seen in patients with atrial fibrillation. The risk of stroke can be dramatically reduced by using a blood thinner called Coumadin. When the blood is properly thinned with Coumadin, the risk of stroke is reduced from 5 to 10% per year to less than 1%. Coumadin, however, does increase a person's risk of bleeding since it is such a powerful blood thinner. In addition, Coumadin will not restore the normal efficiency of the heart by restoring normal heart rhythm. For this reason, when possible, most physicians will try to restore normal heart rhythm in patients with atrial fibrillation. Unfortunately, aspirin, a common blood thinner, is not strong enough to prevent strokes in most patients with atrial fibrillation, and Coumadin is necessary. There are two therapies to return the heart to normal rhythm from atrial fibrillation. The first is electrical shocking, also called cardioversion. In this procedure, the heart is given a single electrical shock, which will often reset the heart's electrical system back to zero, and then the normal rhythm will follow. Certain medications can also return the heart rhythm to normal. Examples of these medications are amiodarone, also known as cardarone, sotalol, also known as beta-pace, and Rhythmol. If a person has been in atrial fibrillation for 48 to 72 hours, there's a substantial chance that a blood clot will have formed in the left atrium of the heart. For this reason, a person with atrial fibrillation is routinely placed on Coumadin if the atrial fibrillation has been present for over 2 to 3 days. After 3 to 4 weeks of thinning with Coumadin, it is safe to try to convert a person to normal rhythm, since by this time the blood clots are dissolved. Since cardioversion, that is, shocking the heart, requires hospitalization and has a small risk of stroke and death, we will ordinarily give a person one of the medications to chemically return the heart to normal rhythm for a month or so. If these medications are successful, electrical shocking can be avoided. These medications used to restore normal heart rhythm will also improve the likelihood that the electrical shock therapy will be successful in returning normal rhythm. Furthermore, many patients will not remain in a normal rhythm without these medications. Once normal electrical activity has been restored, it is important to continue Coumadin for an additional 3 weeks. This will prevent late strokes from atrial fibrillation. For these reasons, the following procedures will take place if you've had atrial fibrillation for more than 2 to 3 days. First, control the heart rate if necessary with digoxin, verapamil, or a beta blocker. Second, start the blood thinning process with Coumadin. Third, wait 3 weeks for adequate blood thinning, then start medication to chemically return normal heart rhythm. Fourth, allow 4 to 8 weeks to see if the medicines return normal heart rhythm. If the medications are not successful, you should be admitted to the hospital for cardioversion or electrical shocking. Fifth, continue Coumadin for an additional 3 weeks, then stop Coumadin if normal electrical activity is still present. Alcohol, caffeine, and tobacco products are all strong stimulants to the cardiovascular system. By totally avoiding alcohol, using decaffeinated coffee, and avoiding all types of tobacco products, you can substantially reduce your risk of developing atrial fibrillation. By working together, we can either convert you to normal heart rhythm or prevent the complications of atrial fibrillation by thinning your blood and adequately controlling your heart rate. I hope this educational video has helped you understand the nature of atrial fibrillation and what we can do together to not only improve the quality of your life, but also the length of your life.